Thank you all for joining us this afternoon. We're excited to jump into some candid but also very beneficial and productive conversations with some friends that we have that cover different types of health organizations throughout the country. And so my name is Alyssa Vásquez. I'm the CEO and president of Cultured Enuf, and we are equity experts that work with small to medium-sized organizations. No matter the funding, no matter the barriers that you may face within your own organization, whether it's structural or cultural, we like to meet you where you're at to be able to assist for a more equitable organization. And that has everything to do with culture as well as structure. And so we're gonna kind of unpack kind of experiences, but also really being able to learn from women who are trailblazing within their organizations. And we wanted to be able to hear from free and charitable organizations as well as federally funded, and those who are CEOs and those who are not. So what the purpose really of this workshop is to be able to engage with them, to really hear from their experiences, hear what efforts they are participating in, but also being vulnerable about challenges. Whether they have overcome them or whether they're still in it, really being able to resonate with that. And then what we'll also do is really open up for Q&A. So definitely wanting to, if there's something that resonates with you, what we do want this to be is a safe space where we're able to ask engaging conversations. We do have, really want this workshop to be for those who are in equity work or who are starting it for the first time. If you are in the presence of really questioning whether this is for you, we also want to engage in that conversation as well. So we're gonna hit it off and being able to hear first introductions, really your name, the city that you're based in with your health clinic, as well as the size, and then if you are free and charitable or if you're federally funded, also helps the audience. So we can get started here.
All right, is this on? Assuming so.
Yep.
So I'm Deb Ortiz-Vásquez. I'm at Esperanza Health Center in North Philadelphia. We are a federally qualified health center, been in existence since 1989. And so our probably our clinician or our staffing is probably about 230, 250. I'm looking for Esperanza people who fact check me. So that's, that's us.
Hi, I'm Amy Richardson. I am from Siloam Health in Nashville, Tennessee. Yeah, some of my coworkers here. We are a free and charitable clinic. We have about 70 staff, 6,500 patients. About 95% of our patients are refugees and immigrants.
Nice.
I'm Breanna Lathrop. I'm the Chief Operating Officer at Good Samaritan Health Center in Atlanta, Georgia. We are also a free and charitable clinic in that sector. We opened in 1999. We have just over 50 employees, and we see about 7,000 unique individuals a year.
And I'm Joslyn Pettway. I'm the CEO of Covenant Community Care in Detroit, Michigan, and we're a federally qualified health center. We've got about 150 employees, 3 sites, and we see about 18,000 patients a year.
Thank you. Thank you. We do have CCHF board members here as well, who are also have a voice at the table, which is great for CCHF in terms of equity. One of the things about organizational change is really undoing and unlearning policies or structure or cultures as well. And so really wanting to ask, what are some successes that you have seen or even indicators of success that you have measured within your organization as well? And anyone could feel free to start, but any successes that you have seen or have worked within your context?
I'll say, I would say that my strategic plan that just got passed last month aligns with what my staff and my patients actually need.
Oh. Mm-hmm.
And so last year was a listening year at Covenant.
Mm-hmm.
We restructured, we expanded some sites, we closed our suburban sites, and so now we have 3 sites all in Detroit. And I didn't want us to assume that we knew Detroit just because we've been there forever. And so all last year, through different listening tours and engagement surveys and community needs assessments, we were just assessing. And then I pulled all the assessments together and I gave them to my board as a briefing book.
Yes.
And I said, listen, our strategic plan has to match what's in this document. Otherwise, you can just kind of be running around doing all kinds of things that don't actually match the needs. So not assuming that we knew the needs
Right.
of the various constituents was a pretty big success for us.
Yep. I love that. Having data is really stories and numbers, and really having that data drive a strategic plan is huge, because there could be a disconnect at times. Yep. Any other successes?
I can go. So we have a diversity, equity, and belonging committee, Deb committee.
She is the committee.
I really did not try to do that, but that's how it came down. And we've grown to 15 people across departmental. We have 3 of our C-suite representatives on that panel or in that committee. We meet monthly, twice, an hour and a half, an hour, so 2.5 hours, which is big time in clinic. And so I think that's been a success. It's been the long road. We're in our 2nd year of this committee, and it's grown, and we have a lot of new, lot of new staff who've joined in. So I would consider that a huge success. It's the long road, right? I will talk a little bit about that later. So I would say that's a great success to have it embedded, and actually Janelle has been helping us think about that committee more formatively. We have a statement, we made some definitions, we've gone through the whole process of really landing somewhere, so I feel that's a success.
It is.
I'm going to follow, because what I was thinking was that the slow and steady doesn't always feel like something you want to name as a success, but I think it is, because it means that we're building with intention and building something that we think will last. So when Siloam was founded, we didn't intentionally set out to serve a diverse patient population, but that's who showed up, and that's who God has brought us, and we have been faithful to that. As an organization, learning to name that and define that and own that has been a process for us over the last 30 years. But we didn't start our intentional staff-focused equity work until 2020, but not 2020 when everyone else was. It was like January we were starting, and then it became the trendy thing in 2020 to do. So we had engaged a consulting firm to work with us as an organization, because it was important, because we saw, even though we were serving diverse patient population and we have a very diverse staff with a high sense of belonging, we still felt like there were opportunities for us to promote more equity and be more inclusive as a staff. So doing that, since then, we have also crafted a DEI mission statement that's aligned with our organizational mission statement. We've created a DEI team. I can't tell you, I'm like looking at one of my DEI team members, how many months it took us to figure out what we were even going to call ourselves, but we're the DEI team. It's very creative that it took us that long to get there.
As long as it exists, right?
Bottom line.
Right.
And we too are proud to have representation from almost every department. We are growing, I'll probably talk about that more later, of how we're filling that DEI team. Has been both a challenge and a success for us. So we're excited to see that. We've created a business case that we shared with the board as well to help promote buy-in there. And that was also many months of work for what seems like a fairly short document. But again, slow and steady, I think, is our strong success.
Slow and steady wins the race.
Right.
One area that I think has contributed to success for Good Samaritan is that also early 2020 we started really rethinking how do we make sure that our leadership at the very top is representative of who we serve and the different departments, that we're not just a medical center with other services, we're a health center, and therefore our farm and our behavioral health and our dental team is equally important as our medical team. And so we said one of the ways that our organization is not reflective of this is that leadership at the highest level is really, really limited, and it's limited to people with certain degrees, and therefore we're restricting who can be at the decision-making table at Good Sam. And because we are a free and charitable care clinic, we do have a lot of flexibility in our org structure. So we experimented and have stayed with kind of what's called a flattened org structure. So we have our founder is our CEO, who actually is only part-time at the clinic. So the main leadership decision is a team of 6 people. and they represent like medical director, dental director. It's our C-suite equivalent, but medical director, dental director, chief development officer, COO, wellness director, and patient access director. And we meet twice a month, and all new policies get reviewed by that committee to say, is this equitable from your lived experience? Is this equitable for the team you represent at Good Sam? And is this equitable from the way you see patient care? Which means that our patient access director, who is filtering all new patient requests and oversees our entire front desk team, is looking at it from one perspective, our dental director another. And so what it's led to is just much more robust conversations and a really better checks and balances of bias in the leadership conversations. It's also, along with that, changed our ethnic and racial makeup of our leadership team, and it's meant that people at the highest levels of leadership represent both people that have terminal clinical degrees, and we have a member that has no college degree and has a lived experience in the workforce and in our community that outweighs, in my opinion, any clinical degree. And I think that what that's created is just a better decision-making model that says, you know, no matter what other things we have in place, that if we are making sure that the leadership is accountable and has that checks and balances, then it's one long-lasting way that we are going to improve the way we do equity work.
I love that. I love that. And in regards to that structure, how do they relate with the C-suite as well? Is it two separate leadership boards, or are they all?
That's the
That's
leadership.
it. The buck stops with them.
That is, I think, what the rest of the world calls C-suite. That was a new term for me, but
Got it.
that is our equivalent.
Wow. And then even the dynamics. So when you have different people from socioeconomic, racial, gender, even education, making sure that that culture there is also viable for people to freely share as well. I'm sure you do that at the same time.
Yeah, I mean, I think it probably the biggest challenge is creating enough space for that you really need to have space to say there's going to be differing opinions, and there isn't a model of like one person trumps another there. I will say the one area it's not diverse is an all-female team, but I do think
Yep.
Yeah.
She said that's fine.
Maybe that's actually helping
Right.
out move some of these discussions go. I don't know, but yeah, I mean, I think we're still learning, and Flatten.org there's not a lot of models out there, and so it's kind of been one of those, we take a risk and we learn as we go, and we don't claim to have it right, but I will say that now we're entering our 4th year, and it's been really transformative for the organization, and personally it's been transformative for me as a leader. Like, I don't want to work in another structure, because I am better because these decisions are made by people that my bias and my inadequacies in those ways, I feel like they are not going to get in the way, because there are people with different and often better experiences and knowledge than I am that help make sure those decisions are equitable.
That's incredible. I think that's key, because I know in our last session we had free and charitable organizations that had about 50 people or less working, and so really being able to see how they were able to get creative with the resources, with the structure that they have, so that their culture and structure also reflect how they want to be seen in the community as well. One thing I want to bring our attention to is just language. So when you use DEI team, you use Deb, and so language is everything in terms of equity work. I want us to define equity from a healthcare perspective so that we could all be on the same page about what that is. And equity is ensuring healthcare workers have what they need to do their jobs, and patients have what they need in and out of treatment settings to effectively benefit from best practices in treatment, not to be confused with equality. And so understanding that equity is getting creative, because not everyone is coming from the same space, getting creative with resources, meeting them where they're at, whether that's physically, emotionally, or mentally, and understanding that it works both ways. It's creating an environment of equity both for patients as well as employees as well. And so, quick question, just want to do a audible, is it? In creating language, how long did it take you? And especially in a faith-based organization, how did you get to defining what DEI is within your org as well?
Yeah, I think that why it took us so long to land on DEI team is because language does matter where we are. We've been doing equity work for a long time at Siloam. We have community health workers for almost a decade now that are promoting equity and bringing the language of our patients to our clinicians, not just the Spanish and Arabic that they speak, but I mean the kind of lay language, the language that they understand, not the medical speak language. And so we've been practicing equity in that way, but there were certain number of our staff and our board that I think were concerned around the words DEI. It carries a lot of connotation for different people, positive or negative, depending on where you land in the culture. And so when we were going through and choosing DEI, diversity, equity, inclusion, we literally made a dictionary of terms for our team, and our DEI team worked on those terms. They looked at a variety of definitions from the internet. They defined them. They paired them with scripture. We kind of just said, these are the words that are I even remember having this specific conversation when I was sharing with one of our board committees. These are the terms that are popular right now. We're using the words DEI because that's meaningful to funders and to other people that are helping us. And it may not be the words we use in 5 years or 10 years, but the principles are the same ones we're going to be using in 5 or 10 years. And so we're landing on these words now, and here are the specific definitions because the principles are what we're going for is important.
I love that. So you're using even what culture is maybe saying, oh, it's a trend or a fad, but you're saying, no, this is how we're defining it now. So this is what resonates most. Yep. Anyone else?
I would just say Esperanza started with the idea of access to Latinx communities. And so every single person who interfaces with a patient has to be competent in Spanish. And so we send them out to language school to do that up to 3 months. So we were premised on the idea of like, diminishing that barrier. So that has to do with access and equity. I think we're moving into like, well, what does that mean? Language-wise, words are important, and they mean lots of things to lots of different people depending on where they sit on the whole spectrum. And also, I think the work that we did was a little bit of painstaking, but also thinking about like our mission and connecting to our mission. And I think when we could connect to our mission, it felt like we had guardrails. And then we looked at scripture and it's like, what is the gospel saying about this? And so we looked at that. And when you match those things up, it's very hard to make a case against. So we did a lot of that deep work and articulated that. So that's how we got there.
Thank you. Is anyone on the panel doing equity work from scratch? Like, you got there and there was nothing. Versus you're working with something that kind of was, you're just molding it and creating. Because I wanted the audience to know and to really see if people are creating it from scratch, how do you even get that conversation started, especially as women or women of color. And then also, if you are working with something that maybe there's holes in it, how do you really bring that to leadership's perspective, if anyone could speak to it?
I'm working from scratch. And that's actually when Alyssa was asking me about the panel, I said, oh, sure, because I like Alyssa. And then I thought, I don't know.
Of course.
But then I thought to talk about that exact thing.
Yes.
Especially, I had been at Covenant about 6 years before I became CEO. I was acting CEO for a year before I became permanent. I became permanent CEO in the summer of 2020. So I'd been around Covenant. We didn't really speak to a lot of current events and things like that. George Floyd happens. And all of a sudden, we're getting all these requests. Make a statement. And I said, we've never, why do we want to?
Why are we doing this
I'm
now?
a week on. So, and I thought about that a lot of times with leaders of color, the assumption is that we'll always know what to say and we'll always know what to do when it comes to DEI issues. So it was like, well, listen, we've got a black CEO now. Let's talk about this. And I'm like, well, we don't even have the infrastructure to talk about this.
Right.
And so one thing I would say is for leaders of color, equip yourselves. Don't feel like you have to jump out Like you have some DEI handbook that nobody else has. Like, no, you're learning too. And one key way to equip yourself is mentorship. So I was 36, CEO of 100 some odd folks. Like, I mean, all kinds of, I said, I need another black woman who's walked this path. And God knows he needs to be very clear with me. I met a black woman named Joslyn. I said, you know what I'm saying? And a believer and just a wonderful person. I have a couple black women who are CEOs, who have been CEOs for quite some time, who have helped me while I'm dealing with equity stuff as a black woman CEO, so that now I'm equipped to lead Covenant. So I just say, if you're starting from scratch, it's okay. And even if you're not a leader of color, wherever you are, if you're starting from scratch, it's okay. But the first thing is to equip yourself first. Do not try to jump out and take the organization somewhere you haven't been. So, you know, that was a key thing for me. And they really were great. Joslyn, Tasha, I text, I call, we have lunch. And they helped me, adjust. And now we're ready.
Yeah. Just out of curiosity, you pursued them?
Yes, I did. Yes, I did. I prayed for a mentor. I said, I don't know.
I should start praying for one then.
I was praying. Listen, I was like, I need a mentor.
Yeah.
And I met them organically.
Okay.
One at a conference. One I had read about her for years. I just met her at a conference, and I said, hey, I've been reading about your career forever. And she looked at me and she said, she looks like me, right? And just in that moment, it was like, oh, okay. And we would have lunch and just connect. And so, if you see people that you admire, if you see folks and you're like, connect with them. And they can be such a support for you as you do this kind of work, so that you don't jump out there and burn out in 2 years, because it's tough. It's really hard. You do not want to do it by yourself.
I want to talk to the non-CEOs. Being able to say that there could be individuals here that want to start equity work or want to take something to the next level. Without that autonomy of a CEO leadership, how have you really taken something to the next level without bulldozing through?
Bulldozers.
Bulldozing.
Wow. I don't know. I think for me it just comes from a place of I have a vision for what the kingdom of God should look on this side of eternity, and I think that's a skill that I haven't quite learned, is not to bulldoze. But I'm learning through this committee, because where I want to go and how fast I want to go is not, you can't just go by yourself, right? So I think it's a place of humility to just have the group lead itself, and just I'm there to facilitate and support. And so that's been a really like a learning experience for me. We're trying to venture into communities. We are in a community of diversity, African American and Latino. And so it's right outside our doorstep, but we haven't been able to engage the African American community. And so that is a learning curve for all of us. And not everyone is on the same page as it relates to that. And so I think it's the small baby step of the next thing that's in front of us to make a decision about, with also having the vision that kind of leads. So yeah, long suffering, humility has taught me a lot to be in that space.
I'll just say that in addition to my work at Good Sam, I spend a bit of time just in the free and charitable world, which is a lot of smaller clinics. And so what I found is sometimes when I go in and I'm here to talk about equity or social determinants or what have you, there's a sense of like, we are barely staying open.
Right.
Like we're not even resistant, we're just overwhelmed.
Right.
And like, who does this? We can't hire a consultant. And one thing that I learned by failing and getting better at was to start with the conversation of that, like, we exist as an entire sector because inequity exists, right? And that, like, you wouldn't have opened your doors if you didn't care about equity and diversity and inclusion. And I also use a slide a lot that stacks up that, like, the medical system was not created for equity. That everything from how funding gets divided and how people are pitted against each other for grants to how we hierarchical structure who gets to stay what in the medical system was designed for inequity. equity.
Wow.
And that what I found is that when people think, oh, I was set up to fail, and oh, I actually already chose equity, that it's opened the doors for conversations where we've said, okay, so what can we do to do this better, versus saying, like, you guys don't do this and you need to start doing it.
Right.
And I found that it just changes people's posture, and it helps them say, like, no, I do. If our values align, and I think Amy was speaking to this, that, like, if we see that outcome and we envision a world as God created it and we can share that, then we have a different space around talking about, okay, so what are the activities and the tools and the structures then that we put in place to advance that within the scope of if you have 4 employees or you have 200. That's going to look different, but it doesn't mean that the outcomes can't be similar or that we can't all get around that shared vision.
Thank you. Thank you for that. She's dropping all this knowledge because she actually wrote a book. So I want you all to look it up. It's How Neighborhoods Make Us Sick, Restoring Health and Wellness to Our Communities. So it's a book really being able to say that her and her partner in the medical field were able to do research in the determinants of health and how we can restore people back as well. How Neighborhoods Make Us Sick on Amazon. Shut up. Okay, moving on. So we're going to provide just a safe space here where we're going to talk about obstacles, really asking you all what are obstacles that you're currently facing, whether they're overcome or not, being able to say this is organizational change in general. I just want to put that out there. This is not something that is magical or lofty. Organizational change is as well as you're bringing people along with you. And so when we ask for a more equitable place, what are the obstacles maybe that you have faced and how have you overcome them, or if you have?
So I think I could, when Alyssa shared this with us ahead of time, I thought I could think of a bunch of different layers of obstacles, whether that's organizational, personal, between the org and the board. But one thing that I think is a little bit unique to Siloam's experience compared to some of the other conversations I've been a part of is doing equity work amongst immigrant communities. So a lot of our conversations in the Nashville area for the 20 years that I worked there have been between Black and white communities. And so when I was doing equity work in the public health space before joining Siloam, I would always be like, but what about the refugees and the immigrants in the city? You're forgetting them. So when I joined Siloam, that part of the work didn't feel new to me, but then bringing sort of the DEI conversation, the race conversation in particular, to immigrant staff, they were like, why do you guys harp on this all the time? Like, we have come from so many hard spaces in our home countries that they also saw it a lot as a Black and white conversation. Like, how does this apply to us? Yeah. And so engaging some of our immigrant staff in that conversation was a unique space. I thought, well, I need to be a listener. It's part of the personal challenge for me is like, I'm a white woman. What am I doing leading this work? But listening well, making sure that I'm not forcing any conversations upon our staff. And so some of the overcoming piece for us has been like, well, what is important to our immigrant staff? Pay equity, opportunities for promotion.
Yep.
And so we began with some of those conversations. The use of language in our staff. When do we use Spanish? When do we use Arabic? When do we use English? What do they want us to use? What do the native English speakers assume our immigrant staff want versus what our immigrant staff want? And immigrant staff is too monolithic a term because different immigrant communities amongst our staff have different opinions about what they want. Age comes into that, country of origin comes into that. So really learning how to be a good listener and engage those staff in the conversation in meaningful ways. So one of the things I'm excited about that we've done this year even, our DEI team had a few non-native English speakers as members, but for a variety of reasons, we're down to one. The staff left the org or chose not to be on the committee anymore. And so we only have one non-native English speaker on our team right now, and we're like, this is not representative of our organization. So Marlo, my colleague in the audience, led some, we call them focus groups because that just seemed like a term we've used in other settings, like conversation groups. Employee resource groups is the HR term or something like that. So we just started conversations with invited staff to come and join and just talk about things that were meaningful to them. And then after 3 or 4 of those sessions, we said, now we're going to invite you guys, if you want, to apply to be on the DEI team, because these are the kinds of things that we talk about.
Yep.
And so then we had more than we could accept apply, and so we are orienting them next week.
Nice.
I think.
That's
And so
awesome.
we're just figuring out ways to make the work meaningful within our own organization,
Yep.
As opposed to sort of a curriculum, which is excellent. If you need one, Enuf has a great one. They didn't pay me to plug that, but
Shut
I
up.
am, because it's been very helpful to us to create a shared vocabulary and create meaningful conversations amongst our DEI team and our senior leaders, and then rolling it out further in the year to come.
I just want to highlight the fact that she knew the different needs of the different immigrant communities shows that work has been done to really assess the data behind that. Not seeing a cultural group or non-Spanish speaking as a monolith is actually a hindrance to equity, because then we're making a lot of assumptions about non-English speakers. Arabic is a very different culture, even experienced in Latin American, and so how are we able to really be able to assess is that data that I'm sure you've collected, because you just spoke to, as well. Any other obstacles?
I guess I'll share that one obstacle that I think is probably specifically an obstacle in the charitable care world, although FQHCs are not excluded from this, is that the board work can be a challenge. And so if you are in the charitable world, there's no requirement about who is on your board. And it is not necessarily designed to be reflective of your patient population. And in the charitable care world, the truth of the matter is that the most important thing your board does is they fundraise, because most of us are fundraising between 70 to 100% of our budgets. But sometimes the people that are the best fundraisers and can bring the most money into the clinic to sustain what you do are not necessarily the people that are the best vision carriers. And ideally you want to align both.
Right.
But the reality of the world is that they don't always align. And so I think one thing that I've had to learn and our leadership has had to learn is how do we communicate with our board that often comes in with very different lived experiences and different just experiences they haven't engaged with our patient population. It's been very different to talk to our staff who live this work day in and day out than it is to talk to a board member who shows up on campus for us 4 times a year. And so I think that is an ongoing challenge, both of how do we grow the board and its diversity, but how do we continue to build board education in a group of people that we really need to stay open, and we really need to engage them in the vision. So I think that's kind of a challenge that I don't say we've solved, but certainly probably when I think about what is the thing that needs the most ongoing work or is the biggest challenge, that's what I would say for
That's so
Good
good.
Sam.
Yep, and board development. So even we just came from Waco Family Medicine where we were doing board development because they have to have a mandate of 50% of their board are patients due to federal requirements. And so in that, it's the same as the leadership aspect. You can't diversify a team or a board and expect everything to be inclusive or expect everyone to have a seat at the table but not a voice. We've always heard that. And so we've been through the terms of psychological safety, emotional intelligence, cultural competency to say that there's going to be a various dynamics on this board, so we need you all to have a culture that's going to facilitate that. But board development is also huge. Yep.
You know, that's a good point. And it's big for FQHCs too, because we do have to have 51% patients.
Yes.
But having the patients and them being comfortable participating in the meetings are 2 different things.
Yep.
And so that's why that briefing book I mentioned earlier, they got that 3 months before we had the strategic planning session, because I wanted them to have time to get comfortable, so that when we put them in a room with my chief medical officer, chief dentals, I'm used to them. But my patient board members, that might be their doctor in the room.
Oh,
and
wow.
then for them to be in that meeting and feel like I'm on equal, solid footing,
Right.
you do have to put
Mhm.
just additional effort into making sure, that's your definition of equity. Like,
That's right.
do I have what I need to carry out what you're asking me to do?
And do I feel comfortable?
Yes.
Yep, sharing
and
that as well.
has there been effort there? So
Exactly.
yeah.
Yep, that's culture. Anyone else?
I was just gonna say a challenge we have because we are in a pretty like African American Latino community, and our staff are, our line staff are all of Latin origin, and this is true to our society. We've kind of bought into this idea of scarcity thinking, and so if I see that we're moving towards what does it look like to engage African Americans to be more of our patients or staff, clinicians, there's this perception that we've bought into that like more for them means less for me. And so there's a big push and a visceral response, and I think it's not a kingdom thinking, it's scarcity, and trying to change ideas around that or try to imagine something different that really reflects, we're shoulder to shoulder, we're doing this work together. And it doesn't mean that it's less, we will receive less, it's more that we will receive more, greater, if we do it together. And so that's a mountain that I don't even know how to climb, but it rears its head pretty often. And so how do we think about, that we're not taking from one to give to the other, but we can do this together.
Yeah, and it's ironic because equity has to do with resources, meeting people where they are at. And so if we think that there's limited resources, therefore one will get that equity access and another will not. Yep. I want to open it up to the audience, that if there's any questions that either you resonate with a federally funded clinic, or you are free and charitable, or you're a CEO or you're not a CEO, really wanting to gauge people's questions very candidly, knowing that this is a safe space where that would love to open it up to anyone in the audience that may have a question. There's no question that's too big or too.
Have you been able to see that African American, so if you just look at your UDS measures, right?
Mm-hmm.
And you look and see that hypertension or diabetes is still a challenge. Are you able to dig down to see what specific patient population is this impacting? And are you able to, within your facility, have a group or a team of people who are actually able to focus on that? And then my other thought is, we all have these internal biases. We all have these internal biases. How are we ensuring that Dr. Smith, when he sees Mrs. Jones, who's an African American female, versus Mrs. Smith, who's a white female, who both have type 2 diabetes, and how are we ensuring that they're getting similar care?
Yep. Yep.
To me, it's nice to have an environment that is equitable, diversity, equity, inclusion. But in my opinion, I'm a dentist,
Yep.
and in my opinion, it's all about patient outcomes. It's all about population health. It's all about being able to have the right UDS measures so you can get the funding or whatever it is you need to be able to continue to provide the care that's needed.
Yep.
I know that was a pretty weighted question, but all of this, in my opinion,
Yep.
goes back to patient outcomes. And how are you
That's right.
being able to help ensure that?
I love that you mentioned that, because even indirectly related to patient outcomes is also a staff development experience as well. So even with saying that even if staff or clinicians have high psychological safety with their provider or with dentists, for example, they're able to ask questions, check their bias. That environment needs to be so, the feedback needs to be there in order for biases to be checked, especially outcome as well. In terms of patient care quality with staff experience or even development, has anyone?
So, I'll go back to summer 2020, and everybody was trying to get a response to George Floyd, and so we pulled this meeting together. It's all the FQHCs in the state, and they said, okay, what is our response going to be? What should our profile picture be? What should our statement be? They were kind of kicking it around, and finally I said, I don't really care what our profile picture is. we're the FQHCs in the state in the middle of a pandemic, and I'm looking at vaccine rates in communities of color that are abysmal. I think a better use of our time is to figure out some different outreach strategies or something like that. And when I said that, it was kind of quiet on the Zoom. And I thought, oops, I might have made my first mistake. And I haven't been a month in. You know, so like, but your point, that's exactly it. Like, this isn't just cosmetic work.
Right.
These are patient outcomes.
Right.
And so we ended up switching that the agenda over to different community outreach strategies to try to figure out how do we identify the hot spots where folks aren't even trying to get vaccinated, why, and who are the groups that aren't here. We got this community, we got some community orgs involved in the group and got them out, and so our vaccine rates went up. So your point is really, really good, and something that I think we have to keep at the forefront whenever we have these conversations. And that's not to say that changing your profile picture and all those kinds, that it just doesn't matter. I'm not poo-pooing it, but if it's July of 2020 and we're a few months into a pandemic, that is not going to be the top of my agenda. It's going to be, wait, we have more resource than that. And so if you're in this room and you're in healthcare, we have more resource than social media protests. We have access to providers and service lines, and we can do things that impact patient outcomes, and that is where DEI really shines, so it's an excellent point.
I think one follow-up on that, as a free and charitable clinic, we don't have UDS measures that we're reporting on. We don't have the staffing capacity right now to be tracking patient measures in the way that some of the larger organizations do. That said, I could get on a soapbox. I'm happy to talk to anyone afterwards about the value that hiring staff that know your patient populations can improve your health measures. We have had very, very strong outcomes with our community health workers. We see using CHWs, we've partnered with a university for those who are not as resourced. We partnered with a university who did evaluation outcome for patients who participated in our CHW program versus matched patients that did not. Their A1C and obesity levels improved and stayed improved over time. So really being able to listen to your patients and doing the work internally will have outcomes externally, even though we're not quite at the point of being able to measure that.
I'd like to follow up because we have that same workforce. We use them, lay health workers, community ambassadors, navigators, and so we're growing that team of people. So we did a research, like a year worth of looking at our numbers as it relates to colorectal testing. And African American numbers were really low, and so we hired a woman from the community who's African American, and she went into looking at care gaps and calling people and saying, "Did you get the test? We could do the FIT test. We could do this. What are your barriers? Building relationship," and we closed that gap. We came, and so it's a research, so we wanted to do it a short while pilot, and then actually we've extended her time to do some other work around some hypertension and such. So we are really looking at what does a community voice, the people with lived experience, have to offer to closing those care gaps, and that's definitely an initiative, and then we're moving forward in that arena where there will be better outcomes.
Even if you are in this work, you sometimes have to educate your colleagues and educate your higher ups to be able to say, no, this is what actually equity works. It is resource as well. And then the second thing you talked about was the board dynamics. Again, we just worked with board development at Waco Family Medicine, and in that room there were patients and congressmen that have served for 25 years on the U.S. Congress. And so the dynamic, we made it so that we can be able to speak to life experiences to level the playing field. And we had prompts ready for them to digest that sometimes the patients are a little bit more smarter than those in the room who think they know what a policy and how it will impact the patient's experience. And so we provide a space where it humbles those that are highly educated, and it humbles those that are on the board for rightful reasons, but really saying that, wow, I didn't even know that you knew that, or you came from that neighborhood that we're actually trying to reach. I didn't know. And so we do that board development to be able to say that everyone has, really from a cultural humility standpoint as well, that everyone has a place at this table, and we shouldn't be, because it's interesting how we're in equity work and we work with organizations that do it, but y'all are doing microaggressions all upside this place. Interrupting each other, overlooking, biases are prevalent. So it's interesting that we all are here for the same reason, to fulfill the mission, but the disrespect is still happening. And so being able to point that out.
There's one quick pro tip around that too. One of my first appointees to our board was a patient who was a former employee who was a former direct report of mine. So she's a CHW. She left to take another CHW job. I said, you want to come be on my board? So the rest of the organization got to see a former employee who's now a patient, who is now my boss. And it had this dynamic of flipping who has power.
Yep.
And who is valued. Mm-hmm. And so you can be very intentional about how you set up your board so that it reflects to everybody. I'm not just bringing, and she's a former employee. So I remember one time I brought something to change the hours. The board has to approve that. Esther grilled me better than anybody else on that board because she worked front desk. So everything that I was saying, she was coming. And that's exactly what I needed. I actually had to go back, get some more information, bring it back, then it got approved. And now I've got like 3 former employees from like just different times at Covenant who are on my board. They're patients.
Wow.
They live by the clinic.
Yep.
And it's shown my staff too, like, oh, there's another way I can be involved here and really have voice. And it has made the things that come out of our board meetings so much more relevant to the organization, because these are the folks who actually work call center, and now they are the top of the organization. Yep. So that's one little tip you can do for FQs who have to have that. It can really flip the dynamic, and it can really bring out that patient voice in a different way.
And it speaks to your leadership that you modeled that I'm going to listen to a frontline staff because they know that specific policy better than anyone could ever.
They have a knowledge I just don't have.
Yep.
And
exactly.
I mean, we're much better because of them. So I've got a former provider now, but I've got some former frontline staff too that are my board members.
Yep. Another question. I think we have time for one more question. I love that. Okay, perfect.
I'm my organization. I'm not on like upper leadership. But what would you say, like step 1, starting place? How do I get the ball rolling to be able to make this happen?
I think find your people. So whether that's a mentor, if there's not someone in your org, or whether you can find a group of people. I do think it's important for organizations. Well, first of all, I'll say I love that you're recognize your capacity for leadership, even though you don't necessarily have it named. So keep that. That should really be step 1. But then also find leadership. I think someone's sitting next to you. But find leadership too, because I think it is really important to find senior level buy-in, because unless you are a flat organization, which are rare, because it is important that they buy in, even if they don't get it in the same way that you get it, getting their buy-in, or at least their blessing to start. We'll do it during lunch, or figure out a way to start. And then there are lots of resources. This is a great, go to all of Alyssa's workshops. And find people here that have done the work. I think those are some things that are helpful, because there's a lot of resources. You don't have to start. You may be starting from scratch in your org, but you're not starting from scratch in this workspace.
True. That's true.
I
think another approach sometimes to add on to that can be helpful too is that if it's new, sometimes I feel like there's especially at a staff level, that sometimes the folks you most want to hear from are at their max capacity and like, I don't want another committee, or they've been burned.
Yep.
They've been like, I got told my voice would matter and my voice didn't matter. Like, we just talk and we say things. So another strategy that I think can be helpful is to choose like an issue that's within the larger framework that's a problem, and say, what if we work together to address this? And what you'll find in the meantime is you start to create those like-minded individuals, you start to have some of those harder questions, and you start to uncover what are the underlying issues here. I know for, just to give a personal example, one area that I really wanted to see changed was to move to a living wage model. Again, I'm in a charitable care clinic. Like, we're not known for paying well, but I just became over the years more and more convicted that, like, how can we ask our staff to do equity in the clinic if they're not experiencing equity in the place that they work? And that, to me, one of the very earliest things was that everybody that's an hourly employee at Good Sam should make a living wage in Atlanta, not a market wage. And so I was like, well, I should talk to someone that's good at numbers. So I went to our fundraising person, and you know, she was like, no, that makes sense. Okay,
Yep.
let's do some numbers. And so what we did, we crunched numbers. So we said, okay, what would this actually cost the organization? Like, we're only 50 employees. What would this cost? We did some data analysis on, like, what do orgs that do this see as their outcomes? So we kind of got our business, I mean, as much as you can call it that. Neither of us are MBA people. And then what we did is we sat in that senior leadership in our flat org, and we said, this is a dream we have. What do you guys think? And the other leaders around there said, A, we want this dream, and B, they said, what if we go to the board when we present this year's budget and we say that this is the gap that this would take over a 5-year strategic plan? If you don't increase our salaries this year, how much dent can we make? And can you meet us if we put something into this?
Okay.
And what the board did was they were like, oh, well, if our entire leadership team, A, cares, B, made a plan, and then C, put something in, then, like, we really have to, regardless of what, you know, whereas I think if we'd started by saying, hey, board, we have this great idea.
Yep.
They've been like, that sounds nice, but the numbers, And so I think that, like, what it did, though, is it helped our senior team wrestle with new topics. It gave us experience making an argument and finding the numbers. And so we got stronger, and we developed new skills that then the next thing that comes up that we'll have more language around it and more experience. So I just think that's like one other way to think about it, is that if you're like, I don't even know how to start a committee, or we only have 10 employees, that a committee would be everybody that works here. But, you know, one other approach is to say, like, what's one big issue that, like, we're not doing well, and let's practice by doing. So.
Yep. I love that. I love that. We have a few minutes left. Thank you so much for sharing your strategies, your challenges, your successes. Any last words to the audience? We would love to hear from all 4 of you to inspire us on how we can start our Monday when we go back to work. Any last words?
I'll just say it's a marathon. It's a marathon. I have a keychain that says it's a marathon from Nipsey Hussle. But it's a marathon. And so that's where the equip yourself is so important. It's a long journey, and there are highs and lows. And so don't do it solo. Do it in community. And give yourself a lot of grace. Give yourself grace. The more grace you give yourself, you have to give to others. So, you know, lots of grace, lots of community.
Yep.
I mean, I was thinking about this question, and it's the long road, and I think what honors God is the journey in which we take. It's not maybe where we land all the time, because you're gonna be working in close quarters with people, and you're gonna try to. I was just in a training earlier on. She used the word rumble a lot. I was thinking about gangs in Chicago, but I don't think she was talking about that. But basically grappling. And, like, how do you do that in a healthy way? And so I feel like it's not the destination so much. It's like, how are we going to do this together in community and do it in a healthy way? And I think that's what honors God. I think also, like, when we're trying to dismantle structures and systems, and there's powers and principalities out there, like, we should not be surprised to get pushback. We shouldn't be surprised by the visceral response of like a no, or even going back to committee and think about that a few times before you come back to us. And so I think that's something, and I think it's just like, when those times come, and I've had those moments, we're not called to shrink back. And I feel like my response sometimes is just, let me go in a corner somewhere and let me just like, hunker down. But the calling is to not shrink back. So I think it's the hard road, but we shouldn't be surprised. So.
That's good. Breanna, Amy?
Two things that I'm personally working on is one, to just continue to get better at being wrong. And I think that if you're doing this work, you're also just you're gonna get it wrong. Especially as a white woman, like, I'm gonna keep getting it wrong, and being better about accepting that and then not letting that stop the movement forward, and knowing how to say sorry and to learn from it. And then I think the second thing is that I think it can get easy to get discouraged, and that, when I get on a Zoom with these women, I'm like, whoa, Joslyn's board. Oh, I don't have a single patient on my board of directors. And that you can either see that as like, we are never going to get there, or we're so far behind.
Wow.
And what I've tried to do is switch my mentality to say, how great is it that there's something more I haven't done yet, that we haven't done yet, that I hadn't thought about yet.
Yeah.
And so I think that it's changing my narrative in my own head, that every time I hear about someone else that's like getting it right, or like doing it better, to be like, that's great news. Because that's like where the hope is.
That's so good. I love that.
Each time I thought of something, I'm like, oh yeah, she just said that.
Right.
So I'm echoing what my colleagues have said, and I will say, the gospel is really big. The gospel is restoring our individual relationship with the Lord, our relationships with one another, with systems around us. And this is system work, and it is the gospel. And it is, the Lord will do this work whether we join him or not, because it is what he has for our heavenly vision. So,
amen. Thank you for that. And so this time tomorrow, I would encourage you to either bring leaders that are still grappling with language. We'll be interviewing CEO CCHF Steve Noblet in Where the Gospel is in DEI in this room specifically tomorrow at 4. And so really the bottleneck that has sometimes approached, especially faith-based, is where's the gospel in, it's ironic, right? But where's the gospel in DEI? In equity work, so that we don't get caught up on language, but that we're able to do the work that we're called to do as well. So that will be happening tomorrow at 4 p.m. in this room. Can I share the scripture that you have here? I want to leave us with a scripture, Hebrews 10:36-39. You need to persevere so that when you have done the will of God, you will receive what he has promised. But we do not belong to those who shrink back and are destroyed, but to those who have faith and are saved. So I want to give it up to just the scripture that clearly points out that we need to persevere in this work. And then also if you could give a round of applause to our amazing panelists. They don't know this, but they're open for questions afterwards. And so if you have any questions that currently relates to your context, please, I'm sure they'll make themselves available. Thank you, right. Thank you, ladies, so much. Appreciate it.